This has been a challenging year in all aspects of our lives, especially for top athletes. While wanting to play the game they love, the NBA has also faced many challenges along the way. Cathy Vigil is an infection prevention specialist at Porter Hospital. She explains why certain NBA rules exist and how they affect most parts of the game.
So my thought on the NBA players getting vaccinated is thinking about the CDC guidelines and their guidance. We know that there's tiers already that are set up, and so we know that tier 1 is healthcare workers and those 70 and older. Then we're moving to 64 to 70-year-olds. When we get down to the 1C tier, because they have it in tiers of 1A, 1B, and 1C. So the NBA players fit in with that, in that tier. So I do think that they'll fall in that tier, unless if they have some diseases that make them get that vaccine sooner. So it's going to be a while, I would say probably in the late spring, that they'll get their vaccination. I think that states should follow the science, of course, and the CDC guidance, and each state should be able to make their own rules and guidelines along with the CDC guidance. And the reason I think about that is because some states are having worse outbreaks of COVID and not following all of the recommended rules. So if your state is following the rules, you should be able to, according to your state, fall on like a tier level, red, green, yellow, or however it's chosen, and make the rules according to that. And if your state can follow the rules and require those that are coming into the state follow the rules, I think that the state should be able to make their own rules within the rules and guidance of the CDC. So I think that we're getting closer. I think that we're always, for the next years, not sure how long, we're going to be wearing masks, we're going to be social distancing, we're going to stay with our groups when we're at big groups like that, because it is a risk to be around groups that we don't know or don't live with. So testing players every day was, in the NBA bubble, they did that, and that was a research study that they did, and it was pretty interesting. And the whole reason behind that was, number one, I kind of believe that maybe the NBA players didn't want to follow the rules early on, and so being tested every day kept their basketball players safe, and it kept everyone safe in the group as far as not getting COVID.
After talking with Cathy, it is clear the NBA is also struggling with the coronavirus. During the coronavirus, the NBA has lost between $350 and $450 million. According to the Washington Post, the NBA plans on recovering their losses by placing a salary cap drop from an estimated $119 million to $113 million. This is CJ Vigil reporting from Cherokee Trail.